So today we'll be talking about the stimulant purgatives. Now, stimulant purgatives are very necessary because they are highly effective. Highly effective means they can increase the stool volume to a significant extent, to that much level that the patient may also get diarrhea if given in excess form. So they are pretty strong stimulant drugs. So as they can cause diarrhea also, they can very commonly cause cramping of the abdomen also. So the patient may get abdominal pain. So we have variety of stimulant purgatives and they are extensively used in different combination and in different medicinal brands, in which one of the famous we have is bisacodyl, which is seen in Dulcoflex, which comes in 1 milligram tablet. Sodium picosulfate, which we very commonly see in Crimafin Plus syrup. We see Senna, Cascara. We see this Prucalopride, which is a 5-HT4 agonist. This Prucalopride, which comes in famous brand Provict and 2-Ease. This is very commonly available. And fixed oils like castor oil is also very commonly used, but this is kind of used as a home remedy. So these are very powerful purgatives. What they do is they basically irritate the intestinal mucosa. So whenever they irritate the intestinal mucosa, they actually do two things. They actually cause accumulation of water and electrolytes in this lumen by modifying or altering the absorptive and secretory activity of this mucosal wall because of causing so many mucosal irritation. So there is increased amount of water and electrolytes which gets accumulated in the lumen, and it increases the stool volume. The second thing, as we know, this intestine has this muscle layer. These stimulant purgatives, they actually directly activate this intestinal muscles also, by stimulating or by activating this myenteric plexuses or the myenteric neuronal fibers. So the activity of this myenteric plexus increases, so the contraction of the gut muscles increases, so they push down the stool firmly and through more pressure. So automatically you get increased motor activity also of the gut and increased quantity of the stool volume which is generated. That is the reason why they can cause significantly increased amount of purgation. So if the patient receives larger doses, then patient may have excess purgation and patient may have hypokalemia or hyponatremia, or the fluid and electrolyte imbalance, or the patient may get land up into dehydration as well. We must understand that these medicines can reflexly stimulate gravid uterus. That is the reason why this medicine should not be given during pregnancy at all. So the famous drugs we'll be talking, that is bisacodyl, which comes in a Dulcoflex, which is marketed and advertised on TV also. It comes in 1 milligram tablet, and it causes stool formation after 6 to 8 hours of taking the medicine. That is the reason why one dose of this medicine is given at night, so that most of the patients do form one or two semi-formed motions. Now, this is available in a suppository form also. So what this suppository do? Suppository are the medicines which are actually deposited, or these are kept into the rectum. What they do, they act by irritating the anal and rectal mucosa, and it markedly increase the motility in this rectum. So evacuation occurs in 20 to 40 minutes. So if anyone has constipation, anyone has the hard stool which is formed there in the rectum, they are not able to give enough pressure. If the patient is saying that they have to do straining, then in that scenario we simply put this suppository which will increase the motility, and they may defecate or they may pass the stool within 20 to 40 minutes. So this bisacodyl in tablet form, it can be taken at as a single dose, at night, and the stool will pass within 6 to 8 hours. Uh, we told this earlier also. In few patients, even at therapeutic or lower doses, cramps and excessive purging can occur. So we have to remember the dosage for each and every patient. The second famous drug is prucalopride or Provect, which comes in Provect brand or Pruease brand. Now, this is selective 5-HT4 agonist, and this is actually indicated for those patients who have chronic constipation. But this is extensively used in constipation patients. This should be actually added when other laxatives fail to provide adequate relief, but nowadays it is very commonly used along with the other medicines for constipation. Now, what they do is they enhance the release of excitatory neurotransmitter, which is acetylcholine. We must remember all the neurotransmitter which originate from the brain at parasympathetic or sympathetic, they always release acetylcholine only. So acetylcholine is the neurotransmitter responsible for the contraction of the gut muscles. So this 5-HT4 agonist, which is prucalopride, it increases the acetylcholine. So automatically it will increase the propulsive contraction in ileum and the more prominently in colon. So it not only increases the motility of small intestine, which is ileum, it also increases the motility of the colon, which is large intestine. The other drugs of 5-HT4 agonist were supposed to have some heart-related complications, but this prucalopride Provect is said to be devoid of any cardiovascular risk and it does not cause any QT prolongation. So it is safe in those patients who have ischemic heart disease. Mostly 2 milligram per day is the dosage, and in elderly patients, we can start even with 1 milligram per day tablet. It comes with Provect and Pruis, these are the main famous brands. The third drug is levetiracetam. Now, this is also a very newer drug which comes with the brand Lubavil. Now, it comes in 24 milligram tablet, and one tablet a day can be given. This drug is also very not commonly used, specialty used mostly by the gastroenterologist, and this can be used in those patients who have chronic constipation which is not responding to the other drugs, and it responds or it acts by stimulating mucosal chloride channels, thereby it increases the intestinal secretion of these liquids, electrolytes, and it increases the stool volume by acting at this mucosal chloride channels. So 24 milligram per day can be given in those patients who have chronic constipation. The fifth drug that we'll be seeing is castor oil. Now, castor oil or Erandi, this is called Erandi in Marathi or in Hindi. So this castor oil actually is an oil which contains high levels of triglycerides and ricinoleic acid. Now, what are these? These are actually polar long chain fatty acids. And this castor oil, when it comes into the ileum, it is hydrolyzed by the lipase enzyme into ricinoleic acid and glycerol. Now, we must know that these two components are highly polar, so these are not absorbed in the gut at all, so they remain in the intestinal loops. These then irritate the mucosa and they stimulate the contractions. So, which is the main activity of the stimulant purgatives is to irritate the mucosa so that more and more water and electrolytes are secreted and to stimulate the myenteric plexuses to cause more and more contraction so that the stool can be propelled forward towards the anus. So, they cause decreased intestinal absorption of water and electrolytes, and uh, by the enhanced secretion by the detergent-like action on the mucosa. And the second thing is the increased peristalsis. Usually 15 to 25 ml can be given in adults at the morning, and usually because of the irritation which is there in the ileum, they actually help to pass the stool within 2 to 3 hours. Most of the time, this motion is semi-fluid. Thank you.